focal ablation is being performed mainly, I would say, in the cryosurgery, but you can see that in the 5th International Symposium for Focal Therapy and Imaging of Prostate and Kidney Cancer, we're going back to Duke, where it started. It will be in the 6th of June 2012, and this is a very exciting field where a lot of radiation oncologists, radiologists, all the companies for imaging, ultrasound, MRI, and urologists are coming together to develop the next generation of focal cancer ablation. And we started because nobody would invite us 5 years ago, so we started the first society which became an international society now with multiple participants, and clearly it sends the right message. HIFU essentially is another thermal therapy which has some interesting mechanism, either thermal or cavitation. It also has some anti-tumor immune activation, which I don't have time to go into it. But suffice to say that there are now clinical trials going. This is a one center, and as every other new technology that needs to go to the FDA, there are challenges of how to design a clinical trial. In this particular case, the company has looked at salvage HIFU, and as we all know, this is quite a challenge and a difficult type of patients to deal with. And this is Mark Emberton's data from the UK, who has a $10 million grant from the government of UK to study HIFU, and he's quite an aggressive center which generated multiple paid publications in the field. Here are two. One is the whole gland, and one focal in the whole gland. You can see that the data, and I highlighted it because I want you to remember when we compare it to the same data from cryo, you see there's not much difference, but with the HIFU, 62% PET-free, leak-free, and 43% 2-year progression-free survival in the whole gland. Not much different with the focal in this very challenging group of patients. What's happening now is the Sonoblade 500 is under FDA phase 3 clinical trial. UCLA is participating, and we have a study here which is right now recruiting patients, and the eligibility is here. I think that this study will probably be complete by either the end of the year, most likely the end of the year or beginning of next year, and we'll see what happens with a potential indication for salvage HIFU for recurrent prostate cancer. The challenge, obviously, and we heard it this morning, is for focal therapy is where is the cancer. We are going to much more details. Once that will be solved, and I'm sure that with all the new technologies that are coming up now, it's just a matter of time till we will identify where the cancer is. At that point, the whole field will change. Ablation therapy will become in many patients the standard of care. And you heard about this paper from the New England Journal of Medicine with the index lesion, the whole theory that there is one index lesion that drives the metastases, and if that's correct, all the rest of the tumors are less important to ablate. It's still controversial, but this is something, again, that the New England Journal of Medicine published 2 years ago, and based on that, we have designed the clinical trial some years ago in trying to identify and do a focal ablation plus minus dutasteride. But eventually, it never, because of funding, it never happened. This was 5 years ago. So today, we don't have the answer. We could have been done by this time. Focal therapy, again, from the UK, you can see 20 men underwent heavy ablation. since we don't know exactly where the cancer, Dr. Amberton is doing saturation biopsy on every patient. Once identified that it's one gland, he's doing a heavy ablation, and you can see that the data here is quite good in this series, what he calls the trifecta, which is continent, potent, and cancer control at 12 months for 89% of the patient with true focal HIFU ablation. Quickly moving to the cryotherapy, I've described it some years ago here, and there's nothing new in the last 3-4 years not in the companies. There's still the same two companies, Galil and Endocare, that are leading the field in this particular area. So it's nothing special. We